Good morning, everyone. Just today, I'm going to discuss a few things about how a GP works in Australia, like what is the day of a GP's work like in the clinical setting. First of all, GPs here in Australia work generally from Monday to Friday. Some of them do a bit of Saturday, or some of them do a bit of weekend. Generally, the GPs work from Monday to Friday, and then they do work from, say, 8:30 to 5:30 or 9 o'clock to 5:30, something like that, roughly around 8 hours work. And then they do have a lunch break, generally a 1 hour lunch break. Some would take half an hour lunch break from 12 to 1 or 1 to 2. And some more, like some GPs, like if they get a bit senior, like if they have worked for a few years, they decide to cut back on their time, like they only do part-time, say 3 days a week, 4 days a week, 4.5 days a week. For instance, myself, I just cut back half a day. Now I only do 4.5 days a week. And like full from Monday to Wednesday, and then half day Thursday, and then full day Friday. So likewise, different GPs do different things. Like they may do only 2 days, they may do 3 days. It depends. And inside the GP clinic, their duties or what they do could vary from emergencies, biopsies, surgeries, to chronic conditions, care plans, diagnosing new things, referrals, and aged care, pediatrics, ONG, you name it. Anything could come through the door of a GP. For instance, for a few years, I worked as a GP. There's many things came through our doors. So you expect anything and everything at your consulting room. So the GP should be, in a way, ready to deal with any clinical condition, any scenario. That's why it's very important for the people coming from overseas, say international medical graduates, to get used to the setting here. As you know, like I got the experience of Sri Lankan GP setting. I don't know much about the other countries, but if you take the Sri Lankan setting, sometimes, yes, the Sri Lankan GPs would also get similar scenarios, but most of the time, more complicated ones directly go to the hospital. Here it's the same. Like if you work in a GP clinic close to a main town or main hospital, like for instance, where I am working, like Bendigo, it's very rarely emergencies things come to you, but it can. Like it, depending on the location of your clinic. Our clinic is located at one end of the town, almost close to like an expanding area, like new houses and things. So sometimes the patients from, say, farming communities or country areas directly come to your clinic rather than going to the hospital in the town, emergency department. So you could get, for instance, our clinic is like a bit of a country clinic, although it is in the city. And I have an experience with being a GP registrar in more country clinics. There you get all the emergencies coming to the GP clinic. For instance, first year of my registrar period, I worked in a smaller town. In that town, we were the only GP clinic, and we were the ones who were looking after the hospital. And then we were the ones who were looking after the aged care facility as well, close by. And then we were running the emergency department on weekends. So it's a full-on GP experience, like a country GP. And through your doors there, you could get all the emergencies, pediatric emergencies, and like cardiac emergencies, respiratory emergencies, gastrointestinal, everything. So I have worked there for first year of my registrarship, and then I got heaps of experience of handling these emergency scenarios. So these things will be asked in your PESCI exams and your AMC Part 2 exams or GP, like FRACGP exam. That's why the things I'm discussing here are important for the guys who planning to come here and work as GPs or hospital doctors. So if you go back to the life of a GP or a day of a GP, as I said, things could be vary from a childhood immunization. So you might get a child to immunize, to give their 2 months vaccine, 4 months, 6 months, 1 year vaccines, or 18 months, or 4 years vaccine. So vaccination, or you will be doing a 6 weeks review of a newborn and the mother, so that could come through your door, or childhood respiratory infections, abdominal pain, things like that. These are very common in our clinics at the moment. And it could vary from asthma action plan to asthma school plan, allergy action plan. So you should be taking a lot of good history around that. Like if the child come to asthma action plan, you will be asking whether they have been to ED, whether they have been having bad sort of exacerbations. They have presented ED, and then are they on a preventer? If the preventer is the dose is not enough, if they say they have frequent visits to emergency, so that means they haven't got a good preventive control. So you need to either increase the preventer or add a second preventer, so likewise. So these are the things GPs would be doing. I can keep talking about different conditions. Then you will get an older patient with say the family concerns that about their driving, or family concerned about family, or he or she herself or himself would be concerned about their memory. So age care assessment, you would get those things. And then patients with chronic conditions like diabetes, blood pressure, obesity, gout, COPD, asthma. So if you got such patients, you will be doing care plans and then referring patients through care plans to different other specialists, if you call it, like, referring to the podiatrist, or referring to a diabetic educator, or referring to another physician, say respiratory physician, geriatrician, referring to a physiotherapist. So you would be doing those things, care plans, health assessments. So immunization, care plans, health assessments, asthma action plans, allergy action plans, and then assessing patients at the GP clinic to see whether they need to go to the hospital or whether they can be managed in the community. So there are so many things. And then, of course, you shouldn't remember the psychiatric conditions you have to deal with. A lot of patients may come with depression, anxiety, PTSD, schizophrenic patient in the community may come to you, or bipolar patient in the community may come to you. So you should be very comfortable with managing psychiatric conditions, knowing medication, side effects, doses. Yeah, so the GP here should be handling those things. I can keep talking, but in general, you can get anything in the GP clinic, and you should be comfortable with managing all these conditions. You shouldn't be like knowing everything about those conditions, but you should be able to see like whether you can manage at the community or whether you need to refer them to the specialist or specialist clinic, or whether you can manage in the community but with frequent reviews, and then work in a team as a team member, which is why the care plan and team care arrangement is important for the GPs, and then managing pediatric population in your area. I think you got some idea about what a GP does in Australia. I'll keep talking about these things in the future.